In today's video, I'm going to be talking about what is the real root cause of iron deficiency anemia and what you need to be concerned about and how to go about addressing it. Now, you've probably heard a lot of people talk about iron deficiency anemia in terms of what the root causes are, from other nutrients, vitamins, and minerals impacting it, as well as GI conditions impacting it, as well as hormonal conditions. And so we're going to touch on all of those today, and we're going to talk about which ones are especially relevant, and how you should approach addressing iron deficiency anemia if you do have it. And as a caveat, I also want to say that this conversation will include low serum ferritin. Serum ferritin is not what diagnoses iron deficiency anemia. Iron deficiency anemia is diagnosed by low hemoglobin on a complete blood count. And then we'll also see some what's called a microcytic anemia. So we'll see red blood cells that are more dense and tiny. So the main cause of iron deficiency anemia that you want to suss out is blood loss. So blood loss could be from a menstrual period. So if you have a really heavy menstrual period, understanding why that's happening, right? The first thing to rule out would be uterine fibroids. If you have fibroids, then that can be a massive cause of heavy bleeding. And so you want to get a transvaginal ultrasound to fully investigate whether or not that is the cause. Now, if you don't have fibroids, you can still have heavy bleeding, and that can come down to a couple of different things, be it a thyroid condition. So hypothyroidism can be associated with heavy menstrual periods. It can also be due to the fact that you're taking a lot of blood thinning medications, blood thinning supplements. So it's a matter of addressing that. But if you have a heavy period, that is a very common reason for low ferritin or iron deficiency anemia. What is the difference between iron deficiency anemia and low ferritin? So low ferritin is like your savings account with iron. It's your storage form of iron. So ferritin starts to drop before you'll see any changes on the CBC with your hemoglobin and your hematocrit. And so you can have a normal CBC, but have low ferritin. And to some practitioners, to some doctors, that is considered to be akin to iron deficiency anemia. We do have some research showing that there are similar symptoms to iron deficiency anemia and low ferritin, like low energy, hair loss, feeling cold all the time, thyroid issues. So it's important to address if you do have low ferritin or low iron. But it's not as simple as just here, take an iron pill. We really want to understand and investigate the underlying cause so that we're not just blindly going in and replacing iron with a supplement, because that wouldn't be good medicine. Other causes of bleeding can be GI related. It could be an ulcer. It could be a polyp. It could be colon cancer. It could be irritable bowel disease. So Crohn's or ulcerative colitis. So these are all things that you would want to go to a gastroenterologist to get scoped and to work up. So that could be a colonoscopy and endoscopy, depending on what your symptoms are, what the situation is, but you want to rule that out. Once you rule that out, and if you don't have any of those problems, now we're in more of the functional realm of issues. So if you don't have anything in terms of what they find on a colonoscopy or an endoscopy in terms of a frank pathology, you can still have things that are sequestering your iron. So one of the more common things would be a malabsorption syndrome. Now, that's kind of an umbrella of different things, but that could include celiac disease, SIBO, so small intestinal bacterial overgrowth or small intestinal methanogen overgrowth. We can also see low iron with H. pylori or Helicobacter pylori infection, which is an infection in your stomach. So you might not have an ulcer yet from the H. pylori, but it can still be sequestering your iron. Now, there's the conversation of parasites, and this is a really trendy topic. So we do have some evidence that shows that some of the more commensal parasites, so like, for example, Blastocystis hominis, commensal means that it's a normal bug that exists in your gut and for some people is not harmful. But we do have evidence to support that people who have that present in their gut microbiome may have lower levels of iron in their body, but that doesn't necessarily mean that it is causative. So we can't for sure say. Blastocystis is an intracellular parasite, so it's completely different than the helminths, which are worms. And those are more endemic in particular areas. So if your history matches that and you somehow picked up a worm in a certain situation, like hookworm, for example, then if you do have a hookworm infection, that could be absolutely causative of the low iron. So that would be something that you would want to rule out. And there are certain tests that you can do for that. We also have the conversation around minerals. So is low copper preventing your ability for your body to utilize iron and transport iron? That is a real concern. I think with copper, you have to be careful because there are people that have high copper, and excess copper is very oxidative. And it also can lead to worsening of ADHD symptoms by depleting your dopamine, increasing your norepinephrine, increasing anxiety. And I've seen people go on beef liver supplements and copper rich supplements that ended up feeling worse over time. What tends to happen is they feel better initially, and then over time, they feel worse. If you have a nutritional deficiency in copper, then you would want to understand why that is and probably eat more copper rich foods, probably work on your gut so that you're absorbing copper, and also monitor your intake of zinc supplementation because zinc supplements can oppose copper. So addressing low iron, iron deficiency anemia, or low ferritin is not as simple as getting an iron IV or taking an iron supplement. Maybe that is indicated in your case, but the issue is that if you do that, it can exacerbate some GI conditions and it can feed more pathogenic bacteria. It can feed worms if you have worms. The bacteria that it can feed are some of the ones also implicated in SIBO. They are the proteobacteria, which are also inflammatory, produce endotoxins, so we don't want too many of those. Now, one trick that you can do is when you're taking the iron supplementation, you can take galactoligosaccharides or GOS alongside it, and that might mitigate some of the feeding of the potential pathogenic bacteria that you might have from iron supplementation. But regardless of whether or not you and your provider decide for you to take iron supplementation, it's still really important to work up the root cause because you don't want to just be on a supplement for the rest of your life. Your body isn't doomed to be deficient in iron forever. You really want to understand why that's going on so that eventually, if you're on a supplement, you can get off the supplement. Thank you so much for listening, and I hope that this was helpful.